We are here to serve the entire Scottish population for advanced heart failure, so we typically get referrals from other consultant cardiologists throughout various geographical regions in Scotland when that patient is struggling. So when they've tried the kind of treatment options such as pharmacology or pacemakers, devices, and if that patient's still got advanced heart failure and they don't have any barriers to more advanced treatments such as transplant, then they'll refer to us. That was a major concern, obviously, as it was all over, that COVID would have a real impact on us being able to deliver our service, and especially not only the beds within NSD but also intensive care. So if those beds needed used for COVID patients requiring ventilation, that would absolutely have had a knock-on effect for our service.
So we had a very big emphasis on keeping the transplant programme going, and with a lot of input with the other transplant centres around the country to see how everybody else was managing to keep their service running. It's a life-saving therapy for advanced heart failure, and our other main concern was the effects of COVID on our immunosuppressed population as well. So we've got lifelong care of post-transplant patients who we have a responsibility of care for.
We're the only heart transplant centre in Scotland, so our beds are very precious, and we try and manage them as effectively and efficiently as we can. But thankfully, I think because of good teamwork, all the departments working together, albeit in general cardiology, the national services, and also intensive care, I think we managed really well. And actually, since the start of lockdown, paradoxically, we've done more transplants than we have in some years. We're very lucky that we are a very close team anyway, and I think we know all our patients very well. They're patients that we've seen for years, and we all, I think, personally speaking, I think we all work very well, and ultimately want to provide the best patient care that we can.
We had staff redeployed from other areas and redeployed to other areas to help deal with COVID, but everybody pulled together really well, and that team spirit really kind of played a part.
Obviously, there were challenges for the wider cardiology services here. For example, not being able to repatriate patients to other hospitals, so the general cardiology and interventional cardiologists had to expand and use additional wards in 2 East or whatever. And although we're separate in national services, we have helped out, so at weekends and things, we will help our colleagues in general cardiology, because essentially I think that's the only way that it will work out. We all, if not now, then when? We all really have had to pull together.
One of the challenges of COVID for our patient group has been the diminished social support that they've been able to receive. In usual times, patients benefit hugely from the support of family and loved ones and being able to have regular visitors, often for prolonged periods of time, whilst they wait as inpatients or recover from their significant surgery. Unfortunately, that's something that they've not been able to benefit from during this time.
The nurses were all very aware of how difficult this was going to be for the patients, so they kind of went to extra efforts to try and make their experience and their stay here as good as it possibly could be. To try and keep people's morale up and try and keep people motivated and doing all the things that they need to be doing to keep themselves well.
The other major thing is lots of our patients are on the wards for months and months while they wait for a heart. So these patients can be there confined to bed if they're on short-term mechanical support such as balloon pumps, where they are in the one room. They're all obviously single rooms, they're in their bed on a machine. And during lockdown then, when we had to say that no visitors were allowed, that really affected the mental health of some of our patients.
What I kind of found was that the staff in the ward, especially like NSD, because there was no visitors allowed, they would sort of go above and beyond. I couldn't actually believe it, at how great the staff were then. But not just that, staff from other parts of the ward were continually asking. My nurses would come in and say that one person had been asking me for the other side of the hospital, see how I was getting on. and I found that it's like I'm an only child and I don't have that much sort of relatives on the go, but I found that my time spent at the Golden Jubilee, I didn't actually realise how many brothers and sisters I have, because they just made my time there amazing. They looked after me, they cared for me, and they went above and beyond to make sure that I was okay.
We see all of our transplant patients, and initially after a heart transplant we see our patients at least once a week, so we have to be able to provide all the adequate and safe follow-up care. So yes, we've actually started new clinics, an additional transplant clinic each week to deal with the extra volume of transplant patients. And to be able to provide a safe transplant service, it's not just the inpatient stay, it's being able to manage them safely and effectively, you know, in the weeks thereafter.
The aftercare I've found for the hospital is unbelievable, because regularly at clinics, I know there's phone numbers if there's anything wrong or I need anything, or they will certainly help to sort anything out that I need. But that's just the Golden Jubilee, and I was I was proud that all the time that I was a transplant patient and everything that went on over the years, and how they've managed to keep me alive and get me to the stage that I am today, and it's all thanks to the SNAHFS team at the Golden Jubilee. I'd just like to say a very big thank you to them all. Thank you.